Hello, my name is McKaylee Fortner, and this is my educational presentation on trauma-informed care in the perioperative setting. So, just an introduction to my presentation. I do want to note that the healthcare setting I chose to focus on is the operating room. My experience in this healthcare setting in the operating room is as a registered nurse. And I also want to preface this does not just pertain to registered nurses. Any healthcare provider or healthcare member that has their hands in the process of the patient care plan has a role in trauma informed care. It is crucial from food delivery to EVS to technicians to nurses to CRNAs to NPs, PAs, and providers. All it's imperative. So, how does past trauma impact health? It's a very big question. However, it doesn't just impact them psychologically, it impacts their health physiologically, majorly. So, a few of those effects. I do want to reference the study in our textbook. It talked about 25% of people who experience four more traumatic events that go untreated, their life expectancy goes down 20 years. Not a year, not a year and a half, 20 years. It's a very big number. A lot earlier mortality for them. I also want to note that when people have trauma and complex traumas, they cope in certain ways, not all the time, not guaranteed. Everyone approaches trauma differently and responds to trauma differently and copes with trauma differently. So, however, common coping mechanisms can be a sedentary lifestyle due to depression and lack of motivation. It can be alcoholism, which can lead to liver disease. It can be smoking, which leads to chronic lung disease, ischemic heart disease, um, even skeletal fractures. The stress on the body from that complex trauma or trauma in general, causing the sympathetic nervous system to be firing constantly wreaks havoc on your hormones. So that's a big physiological effect on the body. And then last but definitely not least, suicide, which needs more awareness. I don't feel like it gets taken seriously a lot of the time, unfortunately. But I do want to ask the question, what is trauma-informed care? Trauma-informed care is individualized care. I want to stress that individualized care. Everyone perceives trauma differently, responds to trauma differently. So, what you're going to do for one patient isn't necessarily what you're going to do for another. Is there a similar approach to it? Yes, but the details of the trauma informed care has to be individualized to that person. But it starts with recognizing and understanding the trauma that they went through and how they're responding to it and the effects of the trauma that is on their body and mental and emotional health, and creating a space for them to be able to feel safe and feel empowered in their care. The six principles of trauma informed care. The first one that we can come with is safety. So just ensuring that they know that we are there to ensure that they're safe, to ensure that their care is our top priority, their well-being's their top priority, and our top priority. So that's the first principle on the list. The second one, trustworthiness and transparency. They need to know that they can trust us, that we practice veracity, that we're transparent in the process and what's going on with the patient and their care plan, especially in the OR. We can talk to them through the process of what's going to happen with them, from pre-op to intraoperative to PACU, answering any questions, any concerns that they have, participating in active listening. It's all very important. Peer support and mutual self-help. So ensuring that they have a support system at bedside preoperatively, before they go back to the OR to help communicate any concerns or any triggers or anything like that. A peer support and support system goes a long ways with these patients. It is imperative for them. I want to mention these are separate steps. However, I do believe that they go hand in hand. Collaboration, mutuality, And the fifth step of empowerment, voice, and choice. So when you collaborate with the patient, you're saying, we want your opinion. We want your ideas. We want your collaboration. You are just as important in your patient care plan than we are. We have the medical knowledge. You know what works best for you. You know what you've gone through. You know your responses to the trauma. How can we collaborate together to make this patient plan of care unique to you, to where it benefits for your outcome, and you have a positive patient outcome? So let's work together as a team. And when you do that to a patient, you allow them to make decisions on their behalf or on their own behalf. It gives them empowerment and it gives them a voice, in turn, able to be that voice with them. And then the sixth one is cultural, historical, and gender issues. So that one I want to talk about. In Flagstaff, we have a big Indigenous community. And kind of going back on that historical trauma that they have, that generational trauma from centuries ago, it still impacts their daily life every single day. It's a big part of their life. And so us as healthcare providers being able to respect that when we take care of them, and to be able to, if they're wanting to address it, if they're wanting to talk about it, whatever it is they want to do, but also having that trauma informed care for things such as that. 3 reasons why trauma informed care application is imperative. So I have 3 things that I'd like to discuss. Prevention of re-traumatization. When you don't allow for a patient to be heard, for a patient to feel safe, for a patient to just build a relationship in general, for them to be able to collaborate with you, it can cause re-traumatization or worsening of their trauma, and can cause regression. Which goes into my second reason why: positive patient outcomes. When you're not allowing to do either any of the prior things that I had mentioned, you're decreasing the patient outcome because they're regressing. They're not able to focus on healing. They're not able to trust you in that. So it can cause a decline in patient outcomes. And then third of all, continuation of advocacy is major with trauma-informed care. You don't want them to just feel like they have a voice. Yes, people can have a voice, but when they don't feel that that voice is being grabbed onto and amplified, right? That's what we are. We're advocates. We amplify the patient's voice. So that's one of the biggest things, is continuation of advocacy when applying trauma-informed care to these patients, making sure that they know that we're there for them. So practical ways to implement trauma-informed care in the operating room. This is an example and one particular intervention that I'd like to bring up. I apologize. This image to the left, this is an image of a healthcare team getting ready to hyperoxygenate a patient prior to intubation. So prior to intubation, we put an oxygen mask on the patient, and it allows them to get 100% oxygen into their lungs to essentially buy us time in case anything goes wrong with the airway. It's a difficult airway. Maybe they're going to do an LMA, but now it won't seal, so now they have to do an ET tube, so we have to get a glide scope. It buys us time. However, people with trauma or complex trauma can suffer from claustrophobia, or it can trigger them. And so one of the CRNAs I work with, something that she had mentioned that I love and I want to communicate for anyone who might else work in the OR, is, especially, she offers this to everyone, but especially if they have trauma in their past, she offers them to take the mask off, and there's kind of like a connector to this, and the connector part of it, they put into the mouth almost like an inhaler, and they breathe in kind of that way. So it eliminates that claustrophobic feeling. And she always gives the choice to the patient. She always says, would you like to do this instead as the alternative? And she tells them, listen, we have to hyperoxygenate you before intubation, but how can we do that? How can we collaborate together to accomplish that, to make it a safer situation for the both of us, but also have a positive patient outcome, not just physiologically, but psychologically? And then for the technicians, whether it's a surgical tech or a core tech, no matter what your role is in the OR, to maintain and encourage a quiet and calm environment. Be the advocate for the patient. If someone's being a little rowdy, we love music in the OR, turn off the music. If you're not scrubbed in, turn off the music so the patient can be calm and quiet. Ensure that noise is to a minimum and that it's a calm, safe environment for them. And these are my references. Thank you so much for listening to my presentation, and I hope it was educational, especially if you work in the OR. I hope that there was something you could take from this.